It's almost 8:15. Welcome back to Breakfast Television. Well, the lockdown on Wuhan, China, once the epicenter of the virus, has lifted today after more than 2 months. At midnight local time, the capital of Hubei province celebrated its reopening with a light show. Transit and shops have been slowly resuming for weeks, but today, people can finally travel out of the city. Wuhan has only reported 2 new cases in the last 2 weeks. No deaths were reported for the first time on Monday. Officials remain on high alert for any possible resurgence. In Alberta, new data shows the province could see up to 800,000 cases and as many as 3,100 deaths by midsummer. That would mean more than 1 in 6 people possibly contracting COVID-19. Premier Jason Kenney released those projections yesterday, including a worst-case scenario that could see as many as 6,600 deaths. Kenney also acknowledged the economic downturn hitting the province due to job losses and sinking oil prices. Right now, Alberta's case count trails behind Quebec and Ontario. The Premier says physical distancing is working, but if it's not practiced, more than 1 million people could be infected.
We simply cannot risk letting the virus loose in Alberta. That would create a public health catastrophe, which would force an even more stringent lockdown in the future. That means that we may have to leave our current public health orders in place until the end of May. It is the only ethical choice when thousands of lives are at stake.
Tracking COVID-19 cases across Canada now, more big jumps in Quebec, bringing the total to over 9,300 cases, Ontario to over 4,700, but both BC and Alberta reported just 25 new cases each yesterday, the smallest one-day increase in weeks. The total is now at almost 18,000 cases, including 381 deaths. More than 4,000 people have recovered, and we are expecting to have new numbers in about an hour. New York State has now seen more COVID-19 deaths than the total number of people killed on 9/11. 731 people died just yesterday, setting a new one-day record.
The bad news is 5,489 New Yorkers have lost their lives to this virus. That is up from 4,758. That is the largest single-day increase.
And the state has been struggling with more than 500 deaths a day since last week. There is some hope, though. Officials say hospital and emergency admissions are down. The U.S. also had its highest one-day death toll, with over 1,800 yesterday. President Trump is continuing to push for an anti-malaria drug, despite no proof it works against COVID-19.
The hydroxychloroquine is I hope it's going to be a very important answer. We're having some very good things happening with it.
And there are reports some doctors in New York and California are routinely using the drug on COVID patients. None have seen any solid evidence it's helping. Justin Trudeau expected to make his announcement any minute now. But first, should BC close its provincial border to all non-essential travel? Jonathan Muma explores that question after the District of East Kootenay sent a request to BC's top doctor.
We're seeing these groups camping throughout our region. So unanimous by 15 members of our board all agreed that we need to stop this.
With international...
Our apologies. We interrupt Jonathan's story. Justin Trudeau is now live in Ottawa. Let's listen in.
Today, we wear pink to stand up to bullying and support those facing discrimination.